How is a CPAP cough different from a regular cough? Have you ever wondered how a cough related to continuous positive airway pressure therapy differs from a regular cough? Let's break it down in a simple way. A cough that occurs during or after using CPAP therapy for sleep apnea is often caused by the pressurized air that keeps your airway open. This air can lead to dryness and irritation in your throat and nasal passages. As a result, you might experience a dry, hacking cough, or even one that produces mucus. In contrast, a regular cough is usually linked to infections like colds or flu, allergies, or other respiratory conditions that are not related to CPAP use. The causes of a CPAP cough can also include nasal congestion, postnasal drip, or irritation from the CPAP mask itself. If your mask does not fit well, if there are air leaks, or if the humidity settings are too low, these can all contribute to your cough. Now let's talk about when you might notice this cough. A CPAP cough often happens during or right after using the machine, and you may notice it especially when you wake up. The good news is that it usually improves within a few hours after stopping CPAP for the day. However, if the irritation continues, it could lead to a persistent cough that lasts several days. Regular coughs, on the other hand, can vary widely in duration and intensity. They are often responses to underlying illnesses or environmental triggers, rather than mechanical factors like airflow pressure. The pressurized air from your CPAP machine can dry out your mucous membranes, which can trigger that cough reflex. If you breathe through your mouth while using the CPAP, or if there are air leaks, this can worsen the dryness and coughing. Managing a CPAP cough can be straightforward. You might want to adjust the settings on your machine, such as increasing the humidity level or changing to a different mask type. Ensuring that your mask fits properly is also key. Keeping your CPAP equipment clean is important too, as dirty tubing or masks can lead to infections that might cause coughing. If you find that your cough persists, it is wise to consult a healthcare provider. They can help rule out other causes or suggest adjustments to your therapy. Regular coughs are typically treated based on their specific causes, like addressing infections or managing allergies. In summary, a CPAP cough is specifically linked to the use of CPAP therapy, primarily caused by airway dryness and irritation from the pressurized air. It differs from a regular cough, which usually stems from infections or other respiratory issues. Understanding these differences can help you manage your therapy more comfortably.